Hi, my name is Patty Gonzalez, and I am going to be performing a head-to-toe assessment. First, I would wash my hands. I would come into the room and I would introduce myself. Hi, my name is Patty. I will be your nurse for today. Could you tell me your name and date of birth? He told me his name and date of birth, and I checked his wristband. Sir, could you tell me why you are here today?
For a head to toe assessment.
Okay, do you know what time it is?
It's around 9 o'clock.
Okay, and do you have any allergies? No? Have you had any trouble with your health recently? Have you been sick? Have you had a cold? No? Do you have had any shortness of breath, any chest pain?
No.
Do you have any medical history of yourself or of your family?
No.
No? Is there anything that any trouble that you're having, anything that you would like to share with us, either medically or anything that's going on at home that, no? Okay. And how, you said your family history, they're pretty healthy, or anything that needs to be expressed? No? Okay. So I would go ahead and begin my assessment. Put some gloves on. And you said you're not allergic to anything, correct? Okay, so first I'm going to start by inspecting his head. I'm looking. I'm going to have him turn this way and the other way. Okay, now I have gloves on, and I'm going to just go ahead and palpate his head. I'm going to go ahead and palpate his sinuses. Do you feel any pain there?
No.
How about here?
No.
No? Okay. I'm going to ask you to press on one side of your nostril and go ahead and breathe in and out. Okay, now do the same with the other. Okay. Now can you go ahead and close your eyes for me? And tell me what you are smelling.
Peppermint.
Mm-hmm. Now keep your eyes closed. Now, you tell me if you can feel me touching.
Yes. Yes. Yes.
Okay? So I'm gonna have you tilt your head back, and I would have an otoscope you can use. And I would look in here, make sure, I wanna put my hand on the tip of his nose, and I would look to make sure that his mucosa is nice and pink and moist. And it is. You can go ahead and open your eyes. Never put that away. So now I'm gonna go ahead and inspect his ears. So for this, I would go ahead and touch here. Do you have any tenderness?
No.
No? Any tenderness here? I would look for any redness. And I would have an otoscope for this as well. I would pull his ear up and back to get a better view. So I'm looking into his ear, making sure that his tympanic membrane is nice and pearly and gray, and I would do the same on the other side. Next, I'm gonna go ahead and look or check his vision or his eyes. So, sir, I'm gonna have you look at this, or well, look at my finger. Okay, I'm gonna test for to see how well and I want you to follow my finger with your eyes, okay? But without moving your head. Okay, now keep your eyes on my finger. Okay, now what I ask you to do is I'm gonna ask you to look at the wall, okay, and then look at my finger. now at the wall. Get my finger again. Okay. So also I would use an ophthalmoscope as well to check to see how well his pupil constricts. So I would have my light, shine it from the side. The other one. Okay, now I'm going to see if good. Alright. Okay, they both constrict nicely and equally. So the next thing I'm going to do is I'm going to palpate his neck and I'm going to check for his lymph nodes as well. I'm going to go ahead and there's nothing noted there. Sir, can you go ahead and shrug your shoulders? No, shrug your shoulders. Okay, you can relax now. So now I'm gonna move, I'm gonna check his mouth as well. And just to make sure that everything, his uvula is midline, that he has a pink, moist mucosa membrane, and checking his tonsils as well, and his tongue. So I would have him open his mouth. Stick your tongue out, open your mouth wide, okay, and I'm checking his teeth as well, make sure everything is intact. And I would stick my tongue blade in there with the light and say ah, okay, so his uvula is midline, you can close. And then his lips look good, they're not swollen, and they look equal in color. So now I'm going to assess his respiratory, and I'm going to listen to his respiratory system. I'm going to ask you to go ahead and take a deep breath. Blow. Again. Blow. Again. Take a deep breath. Okay, he sounds nice and clear. Sir, I'm going to ask if you can sit sideways here. And I'm going to ask you to go ahead and take a deep breath. Okay, let it out. Okay, his chest expansion is symmetrical. Now I'm going to ask you to say 99.
99. 99. 99. 99.
Okay, that sounds good. Or that feels good. Now I'm going to go ahead and percuss his lobes. Do you have any pain when I'm doing this?
No.
Any discomfort?
No.
No? Okay, so you can go ahead and turn around. So now I'm going to go ahead and listen to his heart sounds. sounds good as well. So, sir, I'm gonna have you, lay back. I'm gonna take a look at his, carotid. I'm gonna have you turn to your left. And go ahead and take a deep breath and hold it. And hold it. Okay, you can let go. Now I'm gonna listen to his carotid just to see if there's any bruise. Okay, you can go ahead and sit. So also I would have, assessed his abdomen, I believe it's not included, but I would have assessed his abdomen, his four, quadrants, just to listen for bowel sounds and make sure he's not tender in any of the places that I would, palpate. And I would look, for the contouring of his stomach as well, for any distension, to see if it's rounded and things like that. So now we're gonna move on to his upper extremities. So sir, I'm gonna have you, I would take a look at both of us. Go ahead and put your arms out together like that. So what I'm doing is, I'm just checking to see if everything's symmetrical, if his arms are symmetrical. And if he has any, I'm also looking at his skin as well. Okay, I'm gonna check his capillary refill, his fingers. Okay, you can put your arms out. And also I can test for his deep tendon reflexes, which I would have him, I would check. I don't have the reflex hammer, but if I did, I would check for his brachial reflex. I would hit, and then I would watch for him to reflex. And the same thing with the triceps, and hit to see, make sure that it would have reflex. And the same I would do with the other arm. And down here as well, hit with the reflex hammer, just to make sure that he is moving the lower part of his extremity. Alright, sir, so I'm gonna ask you to go ahead and put your arms up, and I want you to resist, or to push. Now, pull back. Okay, good. He's doing, it's the same on both arms. The same thing right here with your wrist. Okay, now push. Okay, so you can go ahead and put your arms down as well. Also, I forgot to mention about his neck. Could you go ahead and, with your chin, touch your chest, look down. Okay, now go ahead, look up. Now from side to side, and then extend back. Okay, so he's doing that good. So the same thing with his arms. You know, you can check to see their flexion, their abduction, adduction, things like that as well. So now I'm gonna go ahead and move down to his lower extremities. And of course, you know, I would check also, so go ahead and straighten out your, okay, so everything, you know, is the same. And you know, if you wouldn't have pants on, I would go ahead and see, make sure that his skin is not broken down, that everything looks good. Alright, you can go ahead and relax your legs. So then also, if I would have the reflex hammer, I can also check his deep tendon reflexes down here as well. So I would have it. Now I would go ahead and hit. Same thing over here. Okay, and also I would check to see, can you go ahead and flex your, push down, now up. Same thing with the other one, down, and up, okay. One other thing that I forgot to mention with the ears, you can do, the Weber test, the RENA test, to test for conduction and, to make sure that the patient doesn't have any hearing loss, or just to see if they're having any problems with that. Also with the eyes, you can, cause I don't have a lot of these, items, so with the Snellen chart, you can test their eye vision with the Snellen chart to see what their vision is, if it's 20/20, or if they're having problems with their vision. Another thing that I would, include in the assessment is just to check their spine, to see how the curvature of the spine is. So sir, I'm gonna ask you to stand up, and I'm gonna have you to turn around and go ahead and, bend over. Okay, so that looks good, so you can go ahead and, I'm gonna have you take a few steps forward. Okay, you can stop, and I'm gonna have you take a few steps back. Okay, you can go and have a seat. And do you have any questions about anything so far?
No.
No? And also, for a woman, for a female patient, you would do a, like a breast exam as well, and also genital urinary. And the same for the male, you would make sure that that his skin, is looking normal and it's not broken down as well, and that he doesn't have any lumps or masses in the chest area. And the same thing with the genital urinary part of the male assessment, if he's having any trouble with urination, or any other issues like that. And with the abdomen assessment, also, I'm asking them about their bowels, make sure that they're not having any pain, and that they're going regularly, or if they're not having any issues, if there's not any blood that they've noticed, and that they're not having any issues like that. So I believe this completes my head to toe assessment. Thank you, and have a blessed day.